Hello again. So in 57 years of its existence, Bestmed Medical Scheme has had a proven track record of offering members access to an extensive network of healthcare. Over the years, it has been recognized for its outstanding contribution to the medical aid and healthcare industry. To speak more on this, we're joined by Bestmed Medical Scheme CEO, Mr. Leo Dlamini. Mr. Dlamini, a very good afternoon to you, and thank you very much for joining us. So in the current economic context, everyone is focused on being budget-wise. But before we get into pointers on how you can optimize your medical aid benefits, rather, explain to us maybe how medical aid works.
Sure. Thank you. Good afternoon to you too. Basically, how medical aids work, it's actually a very simple model. Members typically make contributions to the scheme. The scheme pools resources from all its members. That translates into buying power. When a member needs health care, they then go to a service provider, and then the scheme will pay based on the scheme rules and whatever option that member is on. It's very important to note that the scheme rules are actually regulated. In fact, there's an approval process that includes the regulator, the Council for Medical Schemes, where annually they approve those rules that are applied, given the benefit options that are given. So that's the one side of it. It's also important to note that medical schemes are not for-profit entities. They're actually also mutuals. In other words, they are owned by the members. And their sole responsibility is to make sure they provide value-add health services to their members. So there's also maybe let's say four categories of schemes. There's what we call closed schemes and then open schemes. Closed schemes typically would have a unique employer offering medical aid to its employees. Nobody else can participate in that. And then the opposite is obviously true, where any employer, any individual can get involved. That's closed versus your open. And then there's administered versus your self-administered. Your administered schemes typically have a private entity that runs the mechanics of the scheme, and they take a sort of a management fee off the top of that. Then you have self-administered schemes that basically where the administration is managed internally, like the Bestmed, for instance. So typically your self-administered schemes, because they control the overheads, what typically happens, and it's not always the case, but typically happens, is that for every rand that you receive from members as contribution, there's a higher percentage that goes towards paying for claims and that. So that in a nutshell is sort of how medical schemes are structured.
And what about industry concepts that are easily confused, medical aid and medical insurance? Could you please explain the difference between the two for us?
Yeah, sure. So like I said, medical aids are regulated, and it's a highly regulated industry. It's regulated according to the Medical Schemes Act. And I think what's more important is that as a member of a medical aid, I have what we call prescribed minimum benefits guaranteed. In other words, there's certain conditions that are just guaranteed by virtue of my belonging to the medical scheme. I have full cover for those conditions. Now, those conditions, that list of conditions is a regulated list in all schemes, whether they're closed, whether they're open, whether I'm on the cheapest, like a hospital plan, on a comprehensive plan. I need to be covered for all of those conditions. Whereas medical insurance is regulated obviously on a different regulator, and it doesn't have to comply to the Medical Scheme Act. They're regulated differently. They can be profit-driven, but also they do not cover your prescribed minimum benefits. And normally these prescribed minimum benefits will range from life-threatening incidents to some of those prevalent sort of chronic conditions that we see in the country. So the insurance product does not necessarily have to cover those minimum benefits. That's the first thing. It's an important point that separates the two. The second part is typically insurance products, they pay out an amount on a trigger of an event. For instance, you are covered for, let's say, trauma, car accident. And the insurance cover will say we'll cover 50,000 or 100,000 for that event where you're in ICU. It does not take into account the cost of being in hospital. In other words, if that medical intervention requires an amount that's above the amount that's insured, medical insurance will pay that 100,000 and no more. Now, we know that 100,000 sounds like a lot of money, but if you are in ICU, for instance, for 4 days, that's 120,000, man. Medical insurance will pay you just 100,000 and then the rest you're on your own. Whereas with us, prescribed minimum benefit is regulated and I have to make sure that you're restored back to health. So I cannot then walk away. If that bill ends up being 2 million, I will fund that in full. So that is a very important distinction between the two.
You touch on value. I guess that leads to the next question in terms of your advice on getting the most value out of your medical aid cover.
Absolutely. That's a good question. So first of all, you just, as members, they need to know their scheme. Know your scheme rules. Take the time to understand what the scheme rules are. Again, I said, scheme rules are very regulated. So they are there to safeguard members' reserves, to make sure that the contributions that are paid are used effectively and they are reserved to be able to take care of unforeseen circumstances going into the future. So understand the scheme rules. That's the first thing. Second thing is understand the option that you've chosen, because there's a whole bouquet of options that I can buy. I can buy a hospital plan. I could do something middle of the road. I can do comprehensive. But understand the option that I've bought and what it has and what it doesn't have. More importantly, understand what your healthcare needs are so that you can then make sure that your option choice is fit for purpose. In other words, there's a good match between what my health needs are and the option that I'm on. Typically, a lot of pain members experience. They buy the cheapest option and find that their medical needs are much higher than what that option provides them, and then they become very unhappy. So that's the first sort of big thing. It's also very important to understand that as a medical scheme, I'm vested in the well-being and the health of my members. Healthy members make for a great scheme because I'm able to take those contributions, put them in my reserves. Why is it important to have healthy reserves? So that I can be able to then benefit the very members going into the future. First of all, I can give them lower increases in the future. Secondly, I can make sure that as I give option benefits, as I enhance the benefits, I make sure that I use those reserves to be able to enhance those benefits. You recall I said a medical scheme is a mutual. So that those reserves are for the members. They cannot be used for anything else. The idea is that you bleed them out towards the members' benefit gradually so that you safeguard. Obviously, when there's unforeseen circumstances like a COVID, the scheme is able to make sure that its members are covered. So it's very important to understand that a scheme is vested in the members' health. What does the scheme then do in that mandate to make sure that members are healthy? It makes available certain things like wellness programs, preventative interventions, maternity programs. It even has things with disease management where you are helped to manage your chronic condition, whatever that condition is, because we believe in you being healthy. A healthier member is a better performance scheme, better reserves, safer for the future for everyone.
Mr. Dlamini, with this context, where do you see medical aids going? What is the future for medical aids?
Good question. So right now there's a raging debate about the NHI bill specifically, and there's submissions that are being made to the parliamentary committee, that's portfolio committee that's looking at from healthcare, looking at the bill. The bill, by and large, is trying to achieve a very noble idea of universal access to healthcare for all South African residents, all citizens in the country. Now it's grand. But the bill, the way it's structured for now, says that medical schemes will not be able to cover elements in the NHI, National Health Insurance. Now that basically relegates the role of medical aids to almost the peripheral services, which is not viable. Now, while the bill says that, I think there has been a live example of how it's not just public healthcare or private healthcare. It's actually a collaboration between the two. Let's look at COVID, for instance. When the virus came into our shores, it was the collaboration between public and private that made sure that there were sufficient beds that are available, ICU units that are available. Pathology groups have been at the forefront of making sure that we're testing and making sure that we understand the clusters of the spread of virus. So it's not either or, it's both. But also, and more recently, we're seeing the vaccine rollout program. Now, you will know that the big pharmaceutical companies, without mentioning names, are very instrumental in making sure that we get the herd immunity, we get South Africans immunized. So you can't, it's not a either or, it's a collaboration. And if anything else, COVID has showed that it's not just government going at it alone to achieve this noble universal access, but it's a partnership between the private sector and public sector. And we see that the role of medical aid as we have it being very instrumental in making sure that we achieve that universal access for South Africans.
Mr. Leo Dlamini is the CEO of Bestmed Medical Scheme. Thank you very much for availing yourself this afternoon. Let's focus